People don't realize that they have dry eye. Actually, my most common complaint from patients are that my eyes are watery all the time. It's a little counterintuitive, but actually watery eyes is the #1 sign of dry eyes, or one of the top signs of dry eye.
Feels like it's harder to take your contact lenses out.
Contact lens wearers can't wear their contacts as long. Sometimes they have trouble getting the contacts out. They're not getting as many hours in the day with comfort in the contacts.
So we know that IPL, intense pulse light, was FDA cleared for the treatment of dry eye in 2021. And at Inertia, we have an IPL-based device called broadband light, and it is also able to treat dry eye.
So we have developed together a dry eye protocol that works really well in conjunction with over-the-counter treatment and avoid excessive use of prescription dry eye medications.
Dr. Cooper, she's also my optometrist. She has a lot of patients with dry eyes, and I have a lot of technology that can treat a lot of different conditions, including dry eye. So we have come up with a plan to utilize broadband light and also radio frequency heat with ultrasound to help stimulate the Meibomian gland to release the oil secretions so that patients get more lubrication in their eye. Our treatment is working phenomenally.
And I have actually used the protocol myself, and it's helped me tremendously. So basically, Meibomian gland dysfunction, when your Meibomian glands, which are all along your upper and lower lids, are not producing oil correctly, the IPL and the ultrasound radio frequency help heat those glands to almost melt the oil so it secretes out in the proper form, so it sticks to your eye a little bit better to help prevent your tears from evaporating as quickly. It's a great tool to use in conjunction with over-the-counter tears or as a standalone. After a couple of visits, you may not need any further treatment for a while, which is great for people who are constantly lubricating their eyes with tears over and over again.
Yeah, and the added benefit is that you actually get some skin tightening and some brightening under your eyes. A lot of the way that we've been measuring patients' success with these treatments is that, especially patients that wear contact lenses, they get drier throughout the day and it becomes a little bit more difficult to see and a little bit more uncomfortable. And we have asked our patients that we've experimented with, to kind of rate their comfort level. Did they need to use lubricating eye drops? How long did they feel like they could go with their contact lenses before they felt that dry sensation? And most of our patients, really, I think all of our patients, including Dr. Cooper,
including myself, yes.
have felt an improvement throughout the day without feeling like they needed to put in lubrication or take them out and put their glasses on. The nice thing about the protocol that we created is that it is non-invasive. We're exploring, do we need to do the manual expression, which patients don't really enjoy because it's a little bit invasive and people get a little weird about their eyes. And we have not had to do that so far. So to reassure patients who don't like things near your eyes, with this protocol, you do not need to wear intraocular shields. You just wear normal goggles over your eyes. You do not need to get the manual expression. And if you're the right candidate, which Dr. Cooper can assess, then we should be able to get you a really nice improvement with these treatments.
And there's no downtime.
Nope.
Actually really comfortable and feels good.
Yeah, feels kind of good.
Yeah. So I would say it would be a great idea to just come see me for a routine eye exam and check for what type of dry eye they have to see if they would be a good candidate for this dry eye protocol we've developed. And also it's always a great idea to have the health of your eyes checked. So
and then if you're a good candidate, then come and see me.